physician, and his name is Dr. Tenenbaum. He's a board-certified anti-aging physician with over 20 years of clinical experience. He attended medical school at the Pennsylvania State University College of Medicine, and he's an author. He's an author of Thyroid Secrets for Youthful Energy and Metabolism, which to me is just so exciting to be able to have some time with him today in his busy schedule. His practice focuses on advanced preventative medicine with the early detection of cardiovascular disease, cancer, and neurodegenerative disease. He has performed over 6,000 full-body ultrasounds. Dr. Tenenbaum has expertise in all forms of hormone replacement therapy, and y'all know I'm a big fan of HRT. He also performs regenerative orthopedic injections, helping the body to heal itself from injuries, and arthritis, which is a big thing these days for most people. That comes from a lot of just build-up in the body. His goal is to help his patients feel their best now and to do everything possible to make sure that they live a long and vigorous life. So thank you so much for joining me today. That's one incredible bio. What can you add to that?
Thanks for having me. I don't know what to add to that. That's a nice introduction, and hopefully we'll talk, and whatever knowledge I have, I'm happy to share, and I'm sure I'll learn from you as well.
Absolutely. I have a whole bunch of questions. Let everybody know that we have technical difficulties holding my cell phone. We had an audio issue, so we're kind of trying to do a workaround where we use my phone so that Dr. Tenenbaum can hear me, and ideally everyone can hear both of us. So
Sounds good.
yeah, so you got to do what you got to do. You just can't let things hold you back.
So, Deborah, if I can't hear you, I'll hold up the phone as a sign to be like, "Hey, put the phone closer to your mouth."
Absolutely. Let me just make sure. Yeah, we're still connected. So are you good?
I can hear you. Yep.
Okay, good. So, you have a lot of experience working with people and patients dealing with all sorts of health issues. For me, the hormone side of things seems to be the answer to a lot. At least for me personally, I see it that way. And of course, we've just been through a pandemic where we've been locked down and we have been unable to live our lives as we typically do. And I'm curious about all of this and the effect that our life has on how our hormones function, and particularly how they impact how the brain functions. I made the title of this show, How Hormones Affect Your Success, because everybody wants to be successful. At least I
Right.
think everybody wants to be successful. So what are you seeing now with your patients? We're 2 years into this, and are people finding it difficult for them? Are they going through some shifts physically or mentally? What's happening?
Well, hormonally, it's hard for me to. I can almost kind of separate the hormones separate from the pandemic. Obviously, with the pandemic, we've seen so much anxiety, depression, stress that I see very commonly. And of course, those affect your hormones. When I started with hormones like 20 years ago, it's so exciting, to learn endocrinology, especially anti-aging endocrinology, where you're trying to optimize hormones. Um, I would think to myself, well, hey, I think I have the answer, right? Now I can replace all these different hormones: DHEA, pregnenolone, thyroid hormone, testosterone, growth hormone. Um, so all these hormones have like such a huge impact in someone's life, and it makes such a difference so quickly that I thought, okay, hey, I have such a great tool at my disposal. But I started to realize pretty quickly thereafter that, hey, the brain, stress affects your hormones a lot, and it has a huge impact, right? So, for example, whereas if someone has adrenal fatigue or has adrenal problems, much of that has to do with our brain and how our brain perceives stress, right? So, you and I could be in the same situation where one of us perceives stress and the other person perceives no stress at all. That's going to have a huge impact on our hormones. And of course, the hormones are all interconnected. So, whether it's the thyroid and the adrenals or estrogen and progesterone, testosterone. What's amazing about everybody is we all have the same hormones. We just have them in different quantities depending on our gender, and then we have different, and each person's different, right? There's age related changes that differ between each human being, so it always keeps things exciting. So I don't know if I have a great answer of like, hey, how's it been during the pandemic, other than people have been super stressed out. Hormone replacement therapy and my kind of philosophy on hormone replacement therapy, I don't think has changed with regards to the pandemic, because patients most patients benefit from replacing their hormones. So I can tell you a little bit about my experience, just kind of to separate who I think benefits the most from hormones and who doesn't. So
Yeah,
one of
please.
yeah, because there's always all doctor or all practitioners, right, develop shortcuts of like, hey, who's going to benefit from a treatment or not? Because you don't want to spend a lot of time um, looking for and trying to treat something that's going to benefit a patient minimally. So let's talk about women for quickly. So most women, their thyroid starts to decline pretty young. So I'd say most women in their late 20s, early 30s, there's an age-related decline in the thyroid function. And as the thyroid function declines, depending on how sensitive the woman is, and I'd say about 85% of the women are sensitive, they'll see some consequence for that, meaning that they'll be fatigued or have heavy periods or be cold or have a difficulty losing weight. Those are really, really common symptoms. So, and that just gets worse and worse. So, a 40-year-old who's eating much better than a 20-year-old will have a much harder time losing weight, especially if their thyroid's not balanced. So when I'm looking at hormones, and that's just thyroid as an example for women, I'll say in general, hey, this it's worth talking about, because in the history, hey, how's your energy? How's your well-being? How are your periods? Are you cold? And if the patient has those symptoms, then I'm of course looking for a thyroid problem and looking to optimize the problem. It may not be that they actually have a disease, they just may have age-related decline. So that's kind of how I separate, hey, is someone going to benefit even from one hormone at all? It's like, do they have symptoms of that hormone deficiency?
Right.
Likewise, there may be, for example, I said 85% of women tend to be sensitive, meaning that if their hormones are off, they will tell you. They'll say, "Hey, I don't feel right," and when you replace their hormones, they feel better. There's about 15% of the female population. This is not hard and fast statistics. This is just based off my own experience. There's about 15% of patients who are not so sensitive, and those patients can have crazy fluctuations in their hormones. Their hormones can bottom out, or their hormones can be extremely high. Like for example, estrogen in someone who's pregnant may be 3 4,000, and estrogen in menopause or on your period is below 20. So they can have these huge hormone fluctuations, and some women's brains are so not sensitive they don't even feel it. So there's like no reaction whatsoever. So those women, it's interesting. Like we could go through a huge history of like, hey, how are you feeling? Those women tend to feel good no matter what. So they may be more interested in hormone replacement for youthful skin, good bones, delaying the aging process, but not so much based off how they feel. So that's kind of,
Interesting.
yeah. What were you gonna say?
Well, I was just, you were talking about adrenal, and I remember when I was in my late 20s, this is what really got me on this whole path of wanting to know my body's chemistry, right? I um, I literally was on the sofa for 2 years. Sold my gym and started gaining weight. Wasn't for lack of exercise. I maintained my routine. I maintained my eating habits, but my body just started moving, and I was on the sofa literally for 2 years. I get up in the morning, take my daughter to school, go home, sleep, go back, pick her up at the end of the day. Nobody, no doctors could figure out what was wrong with me, and I had to research, had to try to figure out like why am I off the rails so long, yet I can't function. So that introduced me to the endocrine system. And, for a layperson, just devouring as much information as I could, I thought, wow, you look around at society and you can see people struggling with weight or health or mobility. And, for me, it's like, check me if I'm wrong, is that like the root of it really can be identified with, say, hormonal balance?
I think it's a huge component. Um, I'm curious. Keep telling me your story. Like, did you end up? What got you off the couch and made you better? And then we can talk backwards about like, hey, what made a difference? Because I have a feeling it's probably not only hormones that made the difference.
Yeah, well, I think psychologically I was a mess. You know, I sold my gym. It was very abrupt, so there was no like leaning into it. This is what we're going to do in 6 months or whatever. And it actually was the precursor was I started studying the mind body connection and more of a spiritual path of life. And it really started to make think about how I was thinking about me and how I was thinking about life and how I was limiting myself and I was really hard on myself. So I had all that churning. Then I sold the gym, and with that, I broke up with my boyfriend. We were engaged. It was a 10-year relationship. I sold my house. I pulled my daughter out of school and I moved across the country within like 90 days. It's like, whoa.
Right,
I was
lots of changes.
overwhelmed. And then I moved from a small city of like 40,000 people to a city of millions. I was just like a fish out of water.
Yeah.
It was a bit over the top. And what brought me back was, I think, just laying on the sofa, I finally hit a tipping point where I said, this is ridiculous. This can go on forever. I need to shift something. I don't know what it is I need to shift, but I guess I was pretty much on my knees praying for some kind of sign. And I on a spark, like a spark of hope, perhaps. And slowly, I started to move. I started to get ideas again. I started to breathe with my holes again. I started to want to go work out. So, but it was a hard time out. It really was. And I didn't have any drugs. I didn't have any medications to help me. It was
Right.
just sheer willpower,
Right.
the desire to live. You know.
Well, that's awesome to have, meaning that's awesome to have recovered on your own, right? Without even any help. The so I know we're bouncing around a little bit, but between different subjects, but when a patient has let's say chronic fatigue or adrenal burnout or whatever we're going to call it right now, when the person is so exhausted that they can't get up, the analogy I give is that when someone's just like a little bit off balance, let's say you have a friend who drank a little too much and they're just a little off balance, they're just a little they're, they're a little bit unsteady. You can literally balance them with your pinky. It requires almost no effort for you to retain their balance. Someone who's falling over, you literally have to shove them, right? Shove them back upright, and someone who's fallen on the ground requires a tremendous amount of energy to lift them up, pick them back up on their foot. Then they're off balance, right? And then they balance themselves. So that's the analogy I give in medicine, which is some of my patients just need a tiniest little tweak, like a little pinky stuff, right? Hey, your thyroid's maybe 15% lower than it's supposed to be, or your testosterone needs to be optimized, or the cholesterol needs to be optimized, or the blood pressure needs to be optimized. Just tiny little changes. Those people are upright, vigorous. So they just need a little bit tweaking. Then there's a patient who needs like a good shove, right? Like maybe who's going through something and they need to be shoved. They got out of their good habit, healthy habits, and then hormones can be part of that, and vitamins, dietary stuff, psychological counseling, but they need a shove. And then there's patients who are like, on, like you're saying, on the couch, who need a lot more effort. So usually when you're asking like, hey, how much of that is hormonal? I know that I have known that the hormones are so powerful that they get someone back to feeling better, but it's always going to take more than just hormones, right? So if someone's exhausted and their adrenals are burnt out, and why are the adrenals burnt out? Like I was saying, maybe for psychological reasons, the person has had so much stress, right? That their adrenals are nonstop, their sleep is bad. When the adrenals are off, then it may also correlate with hormonal changes or perimenopause, right? Where there's these changes. So once I balance the hormones, meaning give a little bit of adrenal gland hormone if necessary, thyroid is so good for energy. And many patients almost get when they're in a state of chronic fatigue, many patients, it's almost like their hormones get turned down. So there may be no disease in their thyroid, but their body got used to being in like this state of hibernation. So there's, you and I know about this, but maybe for the audience, there's different types of thyroid hormones. So one of those thyroid hormones is T3. T3 is a very active, potent thyroid hormone that gives you a lot of energy. The body also makes something called reverse T3, which literally does the opposite. It makes you feel sluggish, fatigue, like you're hibernating. So many of my patients who get sick for whatever reason, either they have some type of trauma in their life, or like a job change, or God forbid, a death in the family, or just life stress, or they got sick, they got some type of infection, and that they've been sick and they didn't get better. So why does someone get sick and does they don't get better? They should get better, right? Even an infection will be kind of either cleared or controlled after a few weeks or a few months. But the patients who don't get better, it's almost like their body goes into this inflammatory mode with their hormones, and they end up not having a lot of cortisol. They end up having much too much reverse T3, which makes them feel like they're hibernating. And that's kind of like if you were to assess like how did you feel during those 2 years, right? Just enough energy to survive, but no superfluous energy, right? Nothing extra, just enough to survive. And it's amazing how when you do give someone some thyroid hormone, that helps with adrenal gland hormone if the person's perimenopausal, or if it's a guy, give the guy testosterone if the testosterone's low, balance out the hormones. And that is a good, like, that's like a strong person partially lifting up the patient and almost putting them back to normal, right? And then they still need to say, if the causes of them falling down are not fixed, right? Let's say they're in a abusive relationship. You can give hormones all day. You can use all this energy to kind of prop the person upright, but they're going to get knocked over by their abusive spouse, right? So it's the same thing hormonally, right? If the stressors that created the fatigue in the first place are not somewhat improved, you can give hormones, but they still need extra support.
And that's a really great segue. The title I created was How Your Mother Affects Step. Pretty much 99% of my clients are male CEOs of enterprise companies between the ages of 40 and 60 years old. And a lot of them I've worked with for many years. So I've watched them go through, their own life patterns and changes biologically. So where does the hormone balance or imbalance impact one's ability to think clearly, to make good decisions in a timely fashion,
Yeah.
to execute on desired outcomes instead of
Yeah.
all the negative self-talk, mind chatter, the overthinking, the lack of execution, pulling the trigger to get things done. Like I'm very curious about this.
Okay, well, I'll tell you from my experience, because and like I would say, I'd still say things are multifactorial. They're not all hormonally related. But let's talk about guys and testosterone, because that's like to me, if there's one hormone that I think women benefit from the most, let's say premenopausal women, it's thyroid, no doubt. If there's one hormone that guys benefit from the most, it's testosterone. So if we were to keep things simple, women tend to benefit dramatically well from thyroid, and men tend to benefit dramatically with from testosterone replacement therapy. So let's talk about there's a common misconception that testosterone makes guys like enraged, out of control, overly hyped up, like not normal, right? But if you look at the studies, testosterone does almost it's like quite the opposite. High testosterone, like the secure predator animal that's just calm, relaxed, confident, knows that it's in control. So it's almost like the lower the testosterone gets, the more insecure the guy gets, the more anxious the guy gets, the more jittery the guy gets. And the higher the level of testosterone for most patients, the better they feel. Now, when it comes to like confidence, especially if you're talking about very successful CEO types, these guys like everything dialed in as much as possible. And when their testosterone is off, they will feel exactly what you're saying. Like their ability to make decisions, they're hemming and hawing, they lose confidence. It's not testosterone, of course, helps with sexual function and sexual drive, libido, but it does so much for us cognitively. And they even do IQ tests, and guys who have higher, usually the higher the testosterone, the higher the IQ performance. So it's not just for like sexual function. You know, optimizing testosterone is crucial for brain function for a guy. And if it's, of course, it's good for physical body as well with regards to leanness and muscle mass, which gives a guy confidence, but the psychological effects are vast and very important. I would say, like just from taking care of so many thousands of patients over the years, it's a very interesting thing that it depends where the guy's coming from. So if you take a guy who is, you know, how I was mentioning about if a woman has hypothyroid symptoms, then she's going to likely benefit from thyroid replacement therapy. If a man has low testosterone symptoms, he's highly likely to respond to testosterone replacement therapy. So who's a guy who probably is not going to respond well to testosterone is a guy who probably doesn't need it. If I ask a guy, how's your energy? 10 out of 10. How's your mood? I feel amazing. How's your sex drive? Amazing. How's your sexual function? Like a young man's. Then giving, how am I going to make someone who feels perfect feel, euphoric? That's not the point of hormone replacement therapy, to feel euphoria. It's feel to feel youthful and balanced. So that guy doesn't need it, right? That guy shouldn't doesn't need testosterone, even though that guy may be interested in it because he feels so good. He's just like amped up and he wants, whatever he can do, but he probably doesn't need it. But the guy who benefits dramatically from testosterone is the guy who says, "Hey, my energy is not what it used to be. My sex drive is not what it used to be. My sexual function is not what it used to be. My level of confidence is not what it's used to be. I'm getting a fat abdomen. I'm gaining weight. My body composition is not good." And you start adding all these things up, and you realize, and then you check a guy's testosterone level, and even if it's mediocre or half of what it used to be when he was younger, that may be enough to affect him, depending on how sensitive his brain is, since we all have different sensitivities to these hormones. So that guy ends up feeling amazing. And one of the things I would have never expected, um, I happen to be personally like that first case scenario where I feel good. So like if I feel good, it's hard to feel like, or if I feel great, it's hard to feel like crazy great, right? What's greater than great? Great is good enough. But uh, I was surprised when I started replacing guys' testosterone that these are very successful, amazing individuals, and they would come back to me after 3 months, 6 months, a year, even years later when we talk. They'll say, "Hey, doctor, when you gave me testosterone, that changed my life." Or they'll say something which I thought was like hyperbole at the time. I'm like, they'd say something like, "Hey, doc, you saved my life." And I'm like, "Nah, I just gave you testosterone, right? I didn't save anybody's life." But their brains were so sensitive, and the deficiency of testosterone really did change their life, meaning that when the testosterone was added back, they became their best self instead of just kind of trudging through life. So obviously it's nice for a doctor to hear that, hey, I was helpful, but it's really a joy to see somebody, feeling their best. So that's how I would summarize, like particularly guys and testosterone. That's like a huge factor for overall well-being and just for them optimizing their health and being their best. Deborah, I'm having a hard time hearing you.
How's that? Is that better?
Better. Yeah.
So I do talk to my clients about getting their labs run consistently and having someone analyze them. And this is the thing I'm bumping up against. Then they'll go to their general practitioner, I suppose, and they'll run the labs, and then the feedback they get is, for your age, you're fine. You don't want to do HRT.
Yeah.
It's synthetic, and um, it'll mess you up in the long haul. So I really would love your input on that.
Yeah. Yeah, it's interesting. I would not have thought there's so much variation on how to practice medicine, but certainly the standard practice of medicine is that, hey, if your normal testosterone's 250 to 1,000 on like Quest lab sheet, for example. So if your actually it's to 1,100, so 250 to 1,100. So if your testosterone is 251, oh, you're normal. Let's say you're a 28-year-old guy and your testosterone's 251. That's certainly, even though it falls within the normal range, would the patient benefit from it, the testosterone being 500, 700, or even 1,000? Really, it's a case by case decision. I don't let the labs alone make that decision for me. I really after discussing with the patient, I kind of already know who would benefit it from the reasons I just was talking about. Like if the patient doesn't feel good or has, how else are you going to explain the patient's low sex drive, diminished sexual function, changing body composition? Of course, we can blame it on just age or stress, but age related changes in your hormones make a difference in how we feel. So I think that's the difference between the anti-aging doctors and some of the regular doctors. Naturopaths are actually amazing. They're kind of very similar to anti-aging doctors. I have a very high opinion of naturopathic doctors. Um, but anti-aging doctors all have a sense of, hey, we treat age-related declines in hormones in order to optimize somebody's health and make them feel the best that they can feel. If you are more practicing more standard medicine, and I'm not saying standard medicine's horrible, because if you're treating a whole population, maybe you don't want to get involved with everybody's the details of everybody's hormones. It's much easier just to treat millions of people and just say, oh, hey, you're normal, and not have to do anything. But if someone's trying to optimize their health, certainly um, looking at those levels and being a little bit flexible is helpful. And yeah, it can be very frustrating as a patient seeing different doctors and especially hearing different things. um, I would say one other thing about testosterone is that this idea that it's dangerous, testosterone is really not dangerous. It's part of your body. If it was really dangerous, then you'd have a bunch of 20-year-olds dying of heart attacks and high blood pressure and other problems. Obviously, the higher the testosterone is, the younger the person is, the more vigorous the person is. Now, that doesn't always mean you have to jack up the patient's, the 65-year-old man's testosterone to what it was when he was 20, but there's going to be cases where that's the level you need to get to in order to make the patient feel good. And it's very easy to check the guy for side effects. Side effects of too much testosterone you see in the blood pretty easily. Well, not only would the blood test be a little show too much testosterone, but the red blood cells would get too thick. So that's one of the factors that I actually think about a lot when I'm checking a guy's testosterone. Is that when I do the how's he feeling? If he's feeling great, then it's like, okay, he's benefiting from the testosterone. Let's make sure that it's safe. And the way you check for it to be safe is to make sure that his red blood cells are not too thick, because if they're too thick, either he has to donate blood or we need to reduce the dose of testosterone. And make sure it's not, if his PSA is not elevating the prostate test for cancer. I don't know if you know, but there's controversy still amongst some people that in their mind they're like, hey, testosterone causes prostate cancer, and that's clearly been proven incorrect. Hormones are complicated in the sense that testosterone does not cause prostate cancer at all. In fact, there's many studies that show the opposite, that having high testosterone helps prevent you from getting from getting prostate cancer, excuse me. Now, I don't ever tell a patient, "Hey, let me give you testosterone and let's prevent prostate cancer," because if you live old enough, almost everybody gets a form of prostate cancer. When they do biopsies of cadavers, like 80-year-olds, for example, who have died for other reasons, 80% of 80-year-olds have microscopic prostate cancer. And the thought is 70% of 70-year-olds and 60% of 60-year-olds. So it's not we all have these little cancer cells in our body. It's really about helping control these cancer cells to make sure they don't get out of control. And giving testosterone and watching the PSA is such a simple thing to do. So it's not a reason not to give testosterone. Um, and yeah, so it's something we do. I'd probably say half the males in my practice are taking testosterone.
Yeah, I would think, testosterone causes cancer to every virile 20-year-old guy.
Correct. It's the same concept with women, right? If estrogen caused breast cancer, why doesn't every, 20-year-old get breast cancer? And why doesn't every woman, when she's pregnant and has estrogen maybe 20 times her normal, or at least 10 times her normal range, why isn't she getting breast cancer? So it is multifactorial. I think hormones are promoters for healthy tissue, and they are promoters for, like, if you have a cancer that's got hormone receptor positive for estrogen or testosterone, it does promote the tumor as well. But you have to look at everything in balance, right? As a general rule, the more you make someone like a 20-year-old, usually the better they are, because hormones affect your immune system. They affect every part of you. It's not just looking at one cell in a prostate or one cell in a breast. We're way more complicated than that.
So then I would say that hormones have a direct impact on how we relate to life and how we handle our relationships and our communication. I mean, if it's affecting our ability to get up and get things done, and the ripple effect. And I kind of want to segue to on this because I've become very fascinated by the vagus nerve conversation and that relationship between the gut health and the brain. So what I notice in my clients is as they age and their hormones decline, so did their lifestyle habits decline and become negative. So is that like a cycle where one feeds into the other?
Yeah, obviously every part of us is connected. Um, the in my brain, I separate these things a little bit just to be practical, right? Because the fact that we're so interconnected that a creative person could say like, "Hey, how I could tug on, a hair on my head and how that could impact, let's say, my bowels or something like that," because we're so connected. But then being practical and just like having a system to think about things sometimes make simplifies things. So our more simple, because we're all simple minded, right? We're like the body is incredibly complicated and none of us can understand this whole bag of chemistry that's going on nonstop. So we have to simplify things to understand things. So I would say the hormone, like the vagus nerve in the gut, is a huge connection. How the hormones affect the vagus nerve is a little bit more subtle. In that for example, thyroid has an effect directly on your sympathetic nervous system. Um, but like estrogen and progesterone and DHEA and testosterone, it's a little bit less clear, like its direct effect on the vagus nerve. As you know, the biggest impact on the vagus nerve is like the way to influence the vagus nerve is through your breath, right? Because the breath controls you can stimulate, right, you can stimulate the vagus nerve through that, and then the vagus nerve affects your digestion and your heartbeat and your respiration. So I found when I was like learning more integrative medicine, I'm like, why when I was younger, I'm like, I don't understand why there's this crazy thing about breathing. Like, why do people say, oh, like you don't know how to breathe? It seems like the most ridiculous thing for someone to say. Like, I think I know how to breathe. I've been breathing since I was born, right? It seems like a totally crazy thing to tell somebody, but it took me a long time to like and to mature to realize like, oh, okay, really what they're saying is, hey, there's very few ways to access your body. Like there's the autonomic nervous system. And if I just say, hey, Deborah, make your heart beat 5 times per minute faster right now, like you don't have that control. I don't have that control. I can't just say to my small intestines, like, let's move things up a little bit or let's slow things down a little bit. I don't have control over that. So one of the access points to our autonomic nervous system is through our breath, right? That's something that's automatic, but that can also be overridden. So just like blinking, we naturally blink. I guess you can override your sense of blinking, but when you override your breathing, that's one way to access the autonomic nervous system. And then once I understood that and I understood the physiology, then I'm like, oh, this is why every ancient culture is making a big deal of breathing and breathing techniques and stress reduction through breathing. It's a beautiful access point, and it's something that I've just gained more and more respect. As most Western doctors like myself age and mature, we develop a greater and greater respect for like ancient traditions. It's I see the same thing amongst all the doctors I respect. At the end of their practice, they're basically doing stress management as opposed to, hey, we got to get that cholesterol under control. They're like, well, cholesterol is a component, but not more important than stress management.
Yeah, it's the simplicity that, and I remember got me thinking about when I was in that kind of catatonic state. Um, I wasn't breathing. I would catch myself holding my breath. Now I know a lot of people that do that, and I still do it occasionally, not as much, because I've cultivated a relationship with my body, so I can connect more clearly and feel when I'm not being present and allowing my body to flow the way it's designed to. But that was a big issue, was like holding my breath. And I think that was born out of trauma, some childhood trauma, just holding on for dear life, hoping the other shoe doesn't drop kind of thing.
Right.
But
Well, what's your take? You had asked me the question. What's your take then on that, the vagus nerve, GI system, hormones? Like, 'cause it sounds like you've been doing a lot of studying yourself.
well, for me, I find that once I started understanding that there was a communication thread being the vagus nerve, that kind of opened me up to more self awareness that continues to present itself. The more I pay attention to my body, the more I pay attention to thought pattern and how I'm feeling, like connecting the dots between I'm angry about something and then I feel like this restriction, contraction, and tension in my stomach, and then how that affects the foods I crave or my ability to digest. So I'm just noticing that I can really manage my health more effectively than ever just by being a little bit self-aware.
Right. Yeah, it goes back to, I think, what I had learned, years ago too, which is like getting awesome, like getting really good at hormone replacement therapy is so fun. But to realize that there's something that still controls your hormones, right? Which is, your brain, your pituitary stress is a source of frustration as a doctor because you can't control those things so easily for a patient, right? That's the hard work that a patient needs to do on their own. And a source of great comfort, which is like, wow, how much of our health is really psychological, having good attitude, work, knowing how to work through things, having good coping skills, basically the stuff that you were trained to help people with.
And that's the joy of it, it's being able to help people. I mean, I see people every day that are struggling, and it's like, I just wanted to share with you what I've been learning. And I have two big questions for you to close off, and we've got about 4 minutes left. So, um, one of them is, do we have to actually get some kind of a disease to die? Like, this seems to be a popular way to kick the bucket on the planet. But does that have to happen? I mean, can we just age with our vitality and our zest for life, and then just decide we've had enough and go to sleep? Or do we really have to like wither away with some painful disease in order to check out?
Right. That's a very thoughtful question. These are the things that like myself and a bunch of anti-aging doctors are obsessed with. And so I'll give you my I'll give you my 2 cents, and these are thoughts still in a work in progress, right? I don't think I have all the answers to that. Um, so first of all, you're right. Most people die of some type of illness, meaning that the body has some type of programmed cell death that occurs over time. And you're probably familiar with telomeres. There's only a certain amount of cell divisions that the body wants to do, and then cells want to die. And cells get replaced, but they don't get replaced as vigorously for many reasons as they were. So, for example, if you look at any, I mean, it's pretty obvious. Like every 18-year-old has like beautiful skin, and you're lucky you have beautiful skin at your age. But most people, as you know, do not. Like, so you get someone in their 40s, 50s, 60s, the skin is getting damaged and it's not replacing itself fully like it was when they were younger. So look at this, the simple outward appearance of someone's skin when they're 70 versus a beautiful 17-year-old. There's like no comparison, right? So the same thing's happening in all our organs. That's happening in our heart, in our kidneys, in our brain, in our eyes. So the cells are dying and not being replaced. So there is, at least right now, and just by logic, right, there is a limitation to how many cell divisions you keep losing cells, losing cells, and at some point that organ is no longer functional. It crosses let's say someone's kidneys, their kidneys are no longer functional, they're on dialysis, then they get some infection and then something happens, right? They die. So that's one way, is that very withering process of just uh, slow and steady withering process. And that's what a lot of the anti-aging treatments are meant to do: slow down that aging process. And there's many, that's maybe a discussion for another time, but there's many different things. The whole idea of giving hormone replacement therapy is to prevent some of that shriveling process. Instead of just shriveling up and getting inflamed and scarring down as you get older, is to prevent that. So that's part of my job, is to help patients with that. Then there's the, what you were saying before, that people get diseases. So obviously, if one organ goes before the others, that's the rate limiting step. So part of like my practice of anti-aging medicine is to see like, hey, what is the weak spot in the person's body? So there's a beautiful saying in anti-aging medicine, which is you're only as young as your oldest part. So I'll say that again, like you're only as young as your oldest part. So let's say you have an amazing, let's say the person's 60 years old, but their arteries are beautiful like a 30-year-old, and their skin's beautiful, and you do an MRI of their brain's beautiful, and you check the function of the brain, it's beautiful, but they have bones of a 75-year-old. Well, maybe that's their limiting body part, and unless I spend a lot of time focusing on trying to strengthen their bones are going to be their limitation, right? They're going to break a hip when they're 85 and then have some consequence of that and then die. So that's I don't want to say the fun part of my job. That's part of the comprehensive job of that I have, which is look for the weakest part, try to find out everything that's going on with the patient, and then focus on those things. Obviously, it's not, the attributes just need to be supported and the weaknesses need to be really bolstered in order to make sure that the patient lives like a vigorous life. And I think you and I and almost everybody out there has the same desire, which is not to fade away, right? We want to be pretty vigorous, and then have some kind of event where an organ just kind of like gives out, like someone has a big heart attack when they're like 120 and then dies, and then we're like, hey, that was a pretty good go of it.
Yeah, good exit strategy.
Yeah, that's the kind of desire for most doctors, which is have a massive heart attack when you're very old, but have lived a very vigorous life up to then.
I see. I think HRT being a support system to what we have as an innate design for the health. But if our lifestyle and all of that we consume, from thoughts to emotions to relationships to social media, television, whatever, um, has stress and brain health, our bodies begin to break down, shut down, and not function. Then HRT can come in and support that divine blueprint for perfect health. And we can maintain that until the end of life. That's my agenda.
Sounds reasonable to me. I like what you said about consuming thoughts. I've actually never heard that concept before, but yeah, that's um I think that's pretty wise to think that way. And hormones, like I'm saying, make a huge difference in people's lives. What's cool about hormones is that it has a huge impact today. Like when I give someone hormones, it's going to help them maybe the next day, maybe the week later, but I know about it pretty quickly, and that's very gratifying. To see like a very quick return on your investment when you treat someone with their hormones. And then, of course, there's long term benefits as well, just to prevent that shriveling process that our body wants to do. It's just awesome to give things to make people vigorous. And that's why it's such a joy to see someone who's older and extremely vigorous, because then it's like someone we can look up to be like, okay, I want to be like that when I'm 70, 80, 90, 100. I have a 104-year-old doctor in my practice. I take care of him, and he is amazing at 104. There's nobody who talks to him. His cognition is perfect. He lives independently. He drives. There's nobody who talks to him who doesn't come away thinking to themselves like, okay, if I'm going to make it to that age, that's exactly how I want to be.
That's my mentor right there. Yeah, yeah, absolutely. And so, um, before we go, I want you to get some information about your practice. But one thing I wanted to say is the last podcast I did was on consumerism. And we usually think of consumerism as being material, but really we're consuming all day long everything. The question is, are you allowing yourself to consume, that body,
Shoot,
right?
Deborah, I'm so sorry, you're breaking up that last couple sentences. I can't hear you.
Which part?
Oh, right
Tell
there.
me where
Because you're saying consumerism, and then it broke up.
Yeah, so consumerism of thinking, of emotions, of food, of relationships. it all adds up energetically in our body. And I think that's what we're talking about, is how to keep the body producing its own energy long into life. And that's where the HRT comes in and really helps out.
I think that's supportive, but it's almost like the training that you've had professionally is almost more conducive to that than, I feel blessed to balance people's hormones, but as you know, if people are going to perceive stress in everything that they do and they have very strong anxieties all the time, the hormones are extremely supportive, but like you said earlier, that you don't want to you don't want to antagonize that with the thought processes that are going in our brain. Or just like you said, if you're consuming horrible food and you're giving people testosterone, the person's not going to get all lean and buffed out and strong and feel awesome. He'll feel better than not than if he didn't take the testosterone. But of course, to maximize things, you want to have, like you're saying, be a consumer of healthy things all around and have your hormones balanced.
Yeah, it's a choice. You have to want it. You have to want your life to look a certain way in order to have the discipline to make it happen. If you don't want it enough, all the HRT in the world isn't going to make it click for you, to your point,
Yeah,
right?
yeah, and none of us are none of us are perfect, right? There's an ebb and flow to every one of us. Like no one's on all the time, eating
Right.
perfectly 100% of the time. That's almost like a mental disorder in and of itself. Most people are into it, take a little break, get back into it, take a little break. That's much more natural as a human being to be like imperfect and struggle with different things. And still I think someone can have a very vigorous, long life doing that.
Yeah, the 80-20 rule. Do as best as you can, as much as you can, and some slack.
Exactly. Sounds reasonable.
Yeah. So I know we've gone over. Thank you and for your time and just bringing your heart to the table and helping people. You're not taking new patients, so how can people benefit from your knowledge? Tell us a little more about your book before we say goodbye.
Well, the book's Thyroid Secrets. It's actually in reprint right now, so I need to have it reprinted. And on Amazon, they're selling it for some ungodly cost and some resale. So I have to get some more books out there, and that's called Thyroid Secrets, and by me. The if we have a full practice, so this is not to be self-serving, right? The But I would say most doctors who are like anti-aging doctors. So if you Google anti-aging physicians or the A4M, which is the American Academy of Anti-Aging Medicine, they have a list of doctors who are very qualified and awesome. So that's a good thing. I think naturopaths are amazing physicians, so that's like a good choice, and they tend to be a little bit more reasonable with costs because they are usually cash pay. But yeah, those are two resources, and that's that.
That's fantastic. Yeah, you want to definitely take care of that reprint because it's two things. People need your information, and if you don't do the reprint on it, someone else can.
That's true. That's true.
Hijack it from you. Yeah.
Thank you for the advice. Well, hey, it's been a pleasure talking to you. I appreciate you having me on.
Absolutely. We'll have to do it again and we'll do a deeper dive. It's
So,
been a great overview.
sounds good. All right, you take
All right.
care.
You have a blessed day.
You too. Be
Thank
well.
you.
Okay, bye.